Good day, everyone. My name is Jessica Porras, and I am the Senior Manager for Education and Outreach at CAQH CORE. It's my pleasure to welcome you today to our virtual dialogue with PokitDok. In a Q&A fashion, you'll hear about their operating rule implementation and core certification journey. PokitDok's technology enables consumers to shop for, book, and pay for basic healthcare services. Doing this means they connect doctors with patients, provide business functions for healthcare providers, and help electronic medical records communicate. But before we begin our session, I'd like to mention a few logistical items. You can download a copy of today's presentation from the CAQH.org website. To do so, navigate to the CORE pull-down menu at the top of the CAQH.org welcome screen and select the CORE Education Events page. A link to the PDF version of the presentation can be found under the listing for today's webinar. On this side, you can see a screenshot of the Attendee GoToWebinar dashboard. You should see something that looks similar to this on the right side of your computer desktop. When joining today's session, it's possible you may have joined the audio portion of the webinar using your computer speakers by default. If possible, we would prefer you to join the webinar audio by telephone. To do this, please select the telephone audio button in the audio panel of your dashboard, and the dial-in information will be displayed. Make sure you enter your audio PIN, which is found under your dial-in information. We will save time at the end of today's program to respond to your questions. You're encouraged to submit your questions at any time during this webinar by typing them into the questions panel on your dashboard. We would like to thank our speakers from PokitDok for joining us today. We will properly introduce them a little later, but want to extend our appreciation to Lisa Maki, founder and CEO of PokitDok, as well as Faye Beaubien, Director of EDI Services at PokitDok. Today, we will start off with a brief overview of the phases 1 through 3 CAQH CORE Operating Rules, as well as an overview of voluntary core certification. Then we will have Lisa Maki give a PokitDok company profile, and afterwards, in a Q&A format, we will talk to our guest speakers about how the content and infrastructure operating rules are used in their business, their experience with certification, and also what they see as the future of healthcare in this rapidly evolving world of changing technology and consumer empowerment. We will, of course, have time at the end of the session for your questions. And now, I'd like to introduce our first speaker, CAQH CORE Associate Director, Robert Bowman. Bob?
Great, thank you, Jessica. And just as Jessica mentioned, I do want to provide just a quick overview on the different phases of the core rules that have been required for mandate by the ACA. For phases 1, 2, and 3, there are specific compliance dates, and those dates have come and gone. And those are for specific transactions, both the health plan eligibility and claim status transaction for phase 1 and 2, and the EFT, the electronic funds transfer, as well as the healthcare payment and remittance advice transaction, or the ERA, in phase 3. So all of those 4 transactions do have specific set of operating rules that are required to be implemented by specific HIPAA-covered entities. We also have potential future rules coming out that are specifically related to health plan certification, as well as the phase 4 rule set, which includes claims, referrals, certifications, authorizations, enrollment and disenrollment in a health plan, as well as health plan premiums. Potentially also rules coming for health claim attachments as well. So over a very short period of time, there's lots of change going on, specifically around the administration and the conduct of the HIPAA transaction. On the next slide, to ensure that the industry is increasing the adoption of the transaction as well as improving their use, CAQH Index is a way to track the transition from using manual and paper transactions to the adoption of electronic transactions. And we are tracking the adoption of each of the HIPAA transactions. Particularly here, you'll see some statistics related to the eligibility and benefit verification transaction, the claim status inquiry, claim payment, and remittance advice. All saw an increase year over year by the industry as the health plans have implemented the transactions and the operating rules. Providers are definitely seeing the benefit of adopting these electronic transactions to reduce their manual processes. We're not there yet. As you can see that only 70% of the transactions for eligibility and benefit verification are conducted using the 270-271. 56.5% of the claim status transactions, 61% of the claim payment transactions. So many have adopted the EFT, but still only about 60%. And we haven't even broke 50% yet on the remittance advice. All of these transactions, and we'll talk more about the benefits in just a moment, but as the providers adopt the electronic transactions, they're seeing that they can reduce many of their manual processes that they have in their office. Let me go to the next slide. Just a couple specific details related to the Phase 1 and 2 core operating rules. The rules are specifically designed to establish requirements for data content as well as for infrastructure. For Phase 1 and 2 for data content, this requires health plans to return specific information, data, to the provider in the transaction. So the provider has that information, can share that with the patient, and they can make a very specific business transaction. For example, some of the data content that's required is the health plan name and the coverage dates for that particular member, as well as static financials, co-insurance, copay, deductibles, benefit-specific or base deductibles, if there's any differences between individual or family, for example, as well as in and out of network variances. And it's very important if you're an out-of-network provider, what that means for that member. Also includes remaining deductible amounts, as well as specific error types and information related to errors within the transaction to help conduct the transaction better. There are also specific infrastructure requirements for both of these transactions, for the eligibility and the claim status transaction. This includes a companion guide template for common flow and format, as well as specific requirements around system availability, real-time and batch turnaround times, connectivity and security for the transactions, as well as acknowledgements to make sure that the provider, when they submit the transaction, that they are notified by the health plan or by their clearinghouse that the transaction has been received and will then be processed into the next step. We have similar requirements for Phase 3. And Phase 3 on the next slide details the specific requirements for data content as well as infrastructure for the EFT and the ERA transaction. Now the data content is specific to the 835, the ERA transaction, for the uniform use of the CAQH and RARGs. These codes are used by health plans to notify the provider of what types of adjustments are being made to the claim or the claim line because of specific information that was submitted on the claim. It may be missing, it may be incorrect, it may be invalid, and these types of codes relate that information to the provider. The rule requires that they are now all to be used in a very specific way by all the health plans for 4 specific business scenarios, really the most common business scenarios, because it's an 80-20 approach for these 4 most common business scenarios, really tackle 80% of the problems that providers and health plans told us about when they were trying to resolve this issue with the CAQH and RARGs. For infrastructure, there are specific rules around the infrastructure of the conduct of the 835 transaction, just like we saw in Phase 1 and 2, with the Master Companion Guide, specific connectivity, the requirement of the use of acknowledgements for the 835, there was the added requirement of dual delivery. This ensures that a provider who wants to get off paper remittance advice transactions and move to an electronic transaction, so no more envelopes and breaking up those large packages of ERAs, of your paper remittance advice, and going through and manually keying those, the providers can take the baby steps that they need to adopt the electronic 835 for auto posting. So it will allow them to do that. There are also specific requirements around the EFT and ERA reassociation, because as both of these transactions arrive at the provider's door from 2 different sources, usually the health plan or clearinghouse, and then from their bank, they have to be able to reassociate these 2 transactions back to each other. There are specific requirements around the reassociation data. The final 2 rules in Phase 3 are the enrollment data sets. These are specific rules for EFT and ERA that requires health plans or their agents to ensure that providers can enroll for these 2 transactions electronically. So there's a specific set of data that the providers know they're going to be asked about. They can provide that and ensure that the provider can receive and submit that data electronically to the health plan. So the health plan can conduct all of the enrollment processes that they need to behind the scenes to ensure that the provider can receive those transactions. If we move on to the next slide, we want to just quickly talk about some of the high points and the key benefits of the operating rules for phase 1 and 2 for eligibility and claim status. Obviously, receiving this information about the patient's financial information in real time allows for more accurate patient eligibility verification. The provider has this information, even real time, at the time of service when the patient is still in the office. It does improve that point of service collections because, again, the provider has that information. You can have a discussion with the member while they're in the office. There's also increased revenue efficiency because, again, real-time data ensures that the provider knows exactly where the claim is in the adjudication process of the health plan by conducting the claim status transaction. For phase 3, we see similar benefits as well because there's a standard electronic enrollment for the EFT and ERA. Providers can enroll quickly, easily, electronically to receive these transactions. There's also the potential for reduction in manual claim rework. Because the providers are receiving this data in a consistent way from all the health plans with billing, they're able to more efficiently process the remittance advice data. And if there are any issues, they'll know more quickly what those issues are and can more easily resolve them. We've also seen much reduction in the AR days that providers have because of the automated process of the EFT transaction, the ERA transaction, and the reassociation data, because now they can reassociate these transactions more quickly. It leads to more efficiencies and also can reduce errors in payment posting. On the next slide, we're going to go ahead and transition over to Matthew Albright, who will walk us through the voluntary core certification process. Matthew?
Thank you, Bob, and thank you all for joining us today. We are excited to have PokitDok here, who has recently been core certified. I think we'll hear in a moment that PokitDok is really on the cutting edge of using technology to make the business of healthcare easier for doctors, hospitals, and really for all of us as patients. And with their core certification, PokitDok has further demonstrated that it's maximizing the efficiencies that Bob just talked about, these efficiencies that can be garnered through the use of operating rules. PokitDok isn't certified as a clearinghouse, but software and service vendors, health plans, and providers can all get core certified as well, as is seen by these examples of other core certified entities. And as of this morning, 274 core certifications have been awarded since the program's inception. This range of entities demonstrates that administrative simplification will not work unless we get all the parties involved in those transactions. And this includes organizations that are not necessarily mandated under HIPAA to follow the standards and operating rules, like software and solution vendors. If you're a provider or a health plan, ask your vendors, your software vendors, your service providers, and clearinghouses whether they are core certified, like PokitDok has become, so that you can reap the benefits of operating rules and electronic transactions. I'll take half a minute to remind you a bit about what core certification is. As a program, voluntary core certification is really the gold standard in how a certification program should be developed and administered. This slide outlines the elements that make up a kind of checks and balances that make up the voluntary core certification program. We think that probably the most important element of the program is that the actual requirements that are necessary for an entity to demonstrate conformance with the operating rules, the actual certification test questions, are developed by industry representatives. Those requirements, those test questions, are put through the same thorough review and voting process that the core operating rules go through. That is, they are voted on by entities that actually conduct these transactions. So core certification is really industry deciding for industry what conformance actually means. So this slide shows specific types of organizations that can become core certified. Note that basically any entity, commercial or public, that is part of conducting the eligibility claim status or the EFT and ERA transactions can become core certified. And many of the reasons why an entity gets core certified are based on the basic idea, the basic principle that there is an objective third-party testing and subsequently proving whether your organization is using operating rules as they are meant to be used. That is, as a way to find efficiencies in the administrative cost of healthcare. It's like going to H&R Block or any third-party accountant to help you with your taxes. It's just good practice to find someone outside of your organization to check your work to make sure you did it right. And CORE certification is that kind of check for operating rules. And I'll go ahead and turn it over to Drew now, who's got a polling question.
Great. Thank you very much, Matthew. And before we jump in to our discussion with PocketDok, we just want to ask a quick question, take a bit of a pulse of our audience today. And I will read the question, and then you will see a polling question pop up on your screen where you can answer directly. And we'll pause, and then we'll read the results very quickly. So this question asks, which of the currently mandated CAQH CORE operating rules has your organization implemented? And this is check all that apply, because there might be more than one. So we'll pause just for a brief moment. I will launch the poll, and you'll see it pop up right there. Go ahead and register your selection there, and then we'll share the results in about 10 seconds. We have about 81, 82 people on the webinar, and we see 61% have voted, 63. Take about 3 more seconds, and we'll share the results of everyone. All right, I'll close the poll and share the results with everybody. I see that the largest percentage, 61%, said phase 2, 55% said phase 1, and 53% phase 3, some combination of those three. 20% said not applicable, and 12% said none. I think those are interesting results. Wanted to share that with you. And now we will proceed on with the show. And so first, I would like to introduce our 2 guest speakers from PocketDok. First, Lisa Maki is the co-founder and CEO of PocketDok. Before starting PocketDok, Lisa co-founded Belief Networks, which applied semantic intelligence and predictive analytics for customers from the Department of Defense to Forbes.com. It was acquired by the health and employee benefits company, Benefit Focus, in 2010. Earlier in her career, Lisa held several roles at Microsoft during Bill Gates' tenure, and she's a graduate of Stanford University. The second speaker joining Lisa from PocketDok today is Faye Bobian, who is the Director of EDI Services at PocketDok. She manages PocketDok's trading partner relationships with payers and helped establish formal agreements with more than 392 health insurers during her tenure. These are used for digital health plan enrollment management, to check eligibility for health services based on a patient's insurance plan, to pre-authorize specialist referrals, and submit claims, for example. As a core member of the engineering team, she is involved in documentation, quality assurance, and implementation support. She's a graduate of the University of Michigan, and more recently, intimately involved in the CORE certification process. So, and now, to tell us about PocketDok, we'll start with Lisa Maki. Welcome, Lisa.
Thank you very much. It's great to be here. Yes, PocketDok is an open platform for streamlining the business of health. We provide access to key tools that software developers and health IT professionals use to add services they might not necessarily want to build or manage themselves to their products and organizations. And those services include what we like to call modern clearinghouse, the eligibility, claims, pre-authorizations, enrollment that you were just talking about, as well as other capabilities to put around that, including aggregating access to the scheduling APIs of major EMRs, identity management solutions, and others. Yeah, why don't we go ahead to the next slide. We see that. There we go. This gives a great visual depiction of our APIs. Each one of those nodes is an API or service that PocketDok provides access to. And to think about this, when other industries started to digitize in much the same way that healthcare has been doing, bring much of their businesses online in a digital way, they had to think through which endpoints to offer digitally and how to incorporate that into new software solutions, both for their customers, the patient, and internally for themselves for business administration. So there's a lot of those things starting to be in place, and PocketDok decided to take a very modern view to the clearinghouse services, which is one of the reasons why we're working closely with you, because as we do that, we want to evolve and make sure that we're evolving them according to the correct operating rules and standards that are being developed by you and held by you and others in the industry. So those are all baked in, those operating rules and standards, but in cloud-based web services, so making it even more efficient and operationally cost-effective to offer these services to everyone. And I'll turn it over, I think, to Faye.
I think we're turning it over to me for just 1 second. This is Jessica Porras once again. I'm going to be moderating this upcoming segment of the webinar, and I'm so excited. We are so excited to be talking to PocketDok. They are tremendous innovators in the field of healthcare technology. We're also joined by Robert Bowman and Matthew Albright from CORE. So let's begin. So my first question, it's kind of a big picture question. It's for Lisa. So Lisa, how do PocketDok's various APIs lead to improved interoperability? Would you give us an example, especially for those in the audience less familiar with the concept of an API?
Absolutely, that's a great question. I like to use analogies, especially when helping people who aren't software engineers understand what APIs are used for. It stands for Application Programming Interfaces. In other words, tools that software developers and IT professionals use to do a lot of heavy lifting, programmatic lifting that they need to create their products but aren't necessarily core to their business. And this is common when industries digitize their business practices. It's common to identify a set of universally needed services and bring those online as application programming interfaces. So an example from another industry would be Amazon. So Amazon, when Jeff Bezos first started to sell us books online, he had to call the warehouse, he had to call the book publisher, he had to call the bookseller down the street to see if maybe they had a copy, and then he had to wrap it all up and drive it over to FedEx or the post office himself and sell it. Gradually over time, he created digital solutions for each one of those functions and then started to connect them into seamless, operationally efficient practices. And when he got that right, he said, wow, I bet the rest of the industry will want to use this too. And I can help them and probably make some money off of releasing those as a set of APIs. And that's what we all use today. If you hear someone talking about AWS as a cloud platform that Amazon runs, in addition to storage on that platform, we get access to all of those APIs that he and Amazon originally created to efficiently run an online digital store. So we do that for healthcare. We've identified universally needed services by all healthcare stakeholders, like clearinghouse services, that need to be moved into the cloud for operational efficiency, but need the same security and compliance and other standards that they have in the past. We bake that in and we offer as a set of APIs for any IT professional to use.
So Lisa, I have a follow-up question for you, given what you've just shared with us. How do you see PocketDok evolving in the next 2 to 3 years, and what other issues in healthcare administration do you think you'd like to see your company tackle?
Thank you for that question. In the next 3 to 5 years, PocketDok expects to continue to build out its support of the business of health, all administrative functions in the enterprise, and to be able to host those efficiently via APIs, all leaving and freeing the enterprise and its software developers, IT professionals, emerging digital health companies to focus on their business models, to focus on the user experience and not spend their money and time trying to get heavy lifting, hard programmatic processes to market at scale day one. We can help them do that. We can reduce a lot of that cost and effort. So we'll be looking beyond clearinghouse. We've already included access to the EMRs, specifically around scheduling. We're looking around revenue cycle stability, something that you guys have highlighted and spent a lot of time thinking about, which is why we're working with you. You'll see us probably certainly spend more time connecting to clinical data so that the healthcare organization and their partners can get a full, complete view from the time that they attract and acquire a patient to when they release them from a procedure, a full holistic view of that patient from all of those points, both across the business and across the clinical data. So you'll see us start to move into some of those other areas, freeing organizations to design their best business models and their best patient experiences.
So I'd like to ask my colleague Bob to interject here. Bob, do you see any parallels between the evolution of PocketDok, in which Lisa has just been sharing with us, and the work and the mission that CORE does?
Yeah, definitely. I think that some of the concepts and some of the items that Lisa mentioned that they're looking at over the next short term as well as the long term, I see CAQH CORE doing the same thing. We're going to be continuing our focus on the revenue cycle and looking at different administrative transactions that are conducted. We're building out the infrastructure for many of the rest of the HIPAA required transactions in phase 4. Those rules are set. They're good to go. They're all for voluntary adoption, and they're free on our website available. We're going to be looking probably at data content for many of those transactions to make sure that the transactions can be used more efficiently, specific for some of the data challenges that providers and health plans face. So as PocketDok looks at administrative data, at clinical data that goes within some of these transactions, particularly the claims transaction, this can be very important. I can also see where CAQH CORE will be looking at attachments and looking and seeing where the industry is currently at by conducting an environmental scan, what they're doing, how they're conducting the attachment transactions, and what's going to be important in bringing both the clinical attachments as well as the administrative attachments together and making sure that plans can process those types of transactions, those documents in a more efficient way. So kind of that approach and looking at where the industry is today, where it's best to go tomorrow, and then what we can do as an industry in developing operating rules to ensure that we kind of make a very phased approach progress through time. And again, we don't want to kind of be held back by the laggards. We want to move forward in a pace that the industry can adopt, that we're showing progress.
I'd like to turn it over to Faye now and ask her a couple questions that are a little bit more of a hone-in type of question. Faye, would you walk us through a couple of your APIs or one of your APIs and how the operating rules are used in them?
Absolutely. So, PocketDok has close to 24 APIs, and yeah, one of them that is conformant with operating rules is our Eligibility API. So some of our customers that use this Eligibility API include telehealth companies, health systems, imaging centers, all which need to be able to treat members 24 hours a day, 365 days a year. So we provide them the ability to verify a member's eligibility and benefit information, such as deductible and copayment information, with one of the over 390 health insurance companies you mentioned earlier that we have as trading partners. And so we're not only able to send and receive the X12, 270, 271 transaction, we also maintain a status page with information on PocketDok systems, as well as our trading partner systems, thus providing our customers, full insight into the system availability. And I believe you have here an example of our eligibility transaction. So an eligibility request will come into our system in JSON, which is a more human readable version, which we translate to X12, and so we validate that transaction, and all activities through our system are stored so our customers can easily track their transactions as well as previous activities, and we submit it to our trading partner. So at this point we're constantly monitoring the connectivity with our trading partners and again making that available to our customers.
So Faye, given that, oh, I'm sorry.
Sure.
Did I interrupt?
No.
Forgive me. Well, I was so excited to hear what you were saying that I wanted to ask you, a follow-up question. So when did you know, how did you know about the administrative simplification requirements in the Affordable Care Act? In other words, at what point did you make the decision to ensure that PokitDok was conformant with the operating rules?
Yeah, so our first trading partner connection was with Aetna in 2013, and at that point we ensured that we understood the ACA mandates. There was a lot going on at that same time, as well as X12 standards and capabilities of the health plans, which would later become our trading partners. Because PokitDok manages this connectivity with them, the file validation, as I mentioned, encryption and transmission. So really, we needed to understand how this was early on, what the requirements were to be able to build our APIs. So our APIs were at that point built on these requirements. So, and on CAQH is what you guys are promoting here is, and what was mentioned earlier, exactly why we're working with you guys and why we pursued the certification, so we could effectively share this data and conform to the industry standards.
So I would like to ask my colleague Matthew, who's kind of spends most of his time on core certification. Matthew, is this experience that Faye just described with conformance with the operating rules consistent with what you're encountering with entities as they go through their certification process?
Yes, Jessica. I think Faye pointed out something interesting. I think we're hearing from a lot of vendors and software solutions and those kind of organizations that their health plans that they're working for and working with, and their providers and other clients are asking precisely about these operating rules and whether they're being followed and whether they're being used. And so sometimes the core certification emerges from that. I think there's two ways I think that most organizations come in and use core certification. Some use it as a kind of final test to see if their business practices and their systems meet these requirements, especially if the organization's had to change its businesses, processes, or systems to implement the operating rules. And these organizations, like we talked about before, are looking for assurance from a third party that their systems and processes meet the operating rules. And why not? You've done all this work to make sure your systems are compliant, that your customers are getting all these possible efficiencies. Why not get a certification seal to prove it to yourself and your customers and everyone else? Otherwise, it's like skipping graduation after working so hard on a degree. And I think other entities come in and use core certification as part of their broader implementation plan, and they use it to kind of go down the list to check to make sure that they're meeting each one of the requirements. And so we see the certification testing used that way as well.
So, Matthew and I, as part of our education efforts, like to paint a, perfect rosy picture, but I'd like to ask Faye a follow-up question. When you were going through core certification, did you encounter any challenges or any lessons learned that you'd be willing to share with us and the audience?
Oh, sure. So we definitely encountered some challenges, mainly with the testing scenarios and requirements needed to get the certification, just interpreting those. But the healthcare industry, as it operates, is very complex and difficult to understand. But what we did was dedicate sort of an entire team to ensure we met all rules and regulations, all the requirements to proceed with the testing, so both at the technical level and administrative level. And that's what we've done all along. So, so we ensure we understand the rules deeply, so we can help build these solutions out for our customers.
Thank you. And we agree with you that healthcare can be very complex. So Matthew, if there are entities that are having a similar experience dealing with complexities or just the complexity of some of the testing and certification, what should they do? How can we help them?
And I think Faye had some kind of great implicit suggestions right in what she said. Having a dedicated team that kind of looks at what the gaps in the system are, analyzes the operating rules, and certainly we've got lots of free resources for people to use, for organizations to use when they're starting to sit down and wonder exactly, kind of plot out what exactly this will take. There are documents that help you think through your project plans. There's a whole library of these kind of webinars, many of which have companies and organizations speaking about their experiences and the questions they've had. And we have literally hundreds of FAQs on our website when you run into a question. And if you do run into an issue or a question about the operating rules in your implementation, chances are someone that came before you had the same question, and by golly, we created an FAQ for it. So, and of course, for core certification, you can reach out to us by email with questions, or we can set up phone calls to discuss. And all of these resources and calls and whatever else we've got on the website, these are all free. That's the benefit of CAQH CORE being a nonprofit. We get to give a lot away for free.
That's true, and that's great. So we are very lucky to have, PocketDok's founder and CEO here. So I would like to ask Lisa a couple more questions and kind of, a little bit sort of big picture and looking into the future. So Lisa, what do you see as the major trends in terms of how technology is affecting the healthcare industry, particularly with a focus on the consumer?
Well, you just said probably the primary trend in healthcare today, which is a consumer-driven purchase of a healthcare product. That's now the consumers are paying for a good portion of their healthcare out of pocket each year due to the shift to high deductible plans. That is a market shift and something that will affect our customers, large health systems, and their vendors for many years to come. And that's not changing. That train has left the station. So what we focus on at PocketDok are what are the tools and services that healthcare organizations need in order to meet that market shift, to meet that market challenge, and to better serve the consumerized patient. And what do their vendors need to help them in that effort? And that's the beauty of APIs in our mind, is it allows our health system and payer and vendor customers return their focus to great user and patient experiences, really efficient internal operating models, and less on the complexity, some of which you just heard about today that Faye was talking about, less on the complexity of the underlying infrastructure and compliance and other issues that must be addressed, but perhaps shouldn't have to be addressed by the hospital or should be delivered as services that are easy to consume by their vendor partners who are building solutions for them. So those are the trends. Technology helps remove complexity from the system. It helps automate a lot of that so that the people who are focusing on their business model and their patient experiences can do that and not worry.
It's just an amazing thing how radically and quickly healthcare is changing. And one last question for you, Lisa. Bring us into the future. What do you think an average person's visit to the doctor's office will be like in 10 or 15 years? Are there even going to be visits anymore? What do you think?
There will always be visits, and one of the reasons why we started PocketDok, based on my own personal experience. I had an injury to my spine, and I was looking for a non-surgical alternative, and that I ended up finding a doctor, a person who helped me with that. And there's nothing to supplant the human connection when you have an illness or you have an injury and you're looking for a solution. There's nothing to replace that. But what we will see technology do is make that more efficient, connect you more quickly to that person. It took me 6 months to find my person in a search that should have taken me 6 minutes at most if the data necessary to power that search had been available. And it wasn't. It was trapped in legacy clearinghouse systems that we at PocketDok decided to modernize. So that's the sort of thing you're going to see is quicker time for a patient to find the right provider, the right physician, the right nurse, practitioner, for health systems to be able to identify more quickly who are the patients that need the most, how can they help them, how much could they know about them as they show up to schedule an appointment to correctly match them to the best facility for them within a whole system, and how to guide them through that journey, through the system most efficiently and for the best patient satisfaction. Now, what I've just described are technologies and capabilities that other industries use for things that are nowhere near as serious as your health. But the same technologies can be adapted to make the patient experience a better one, and for hospitals and health systems and payers to do it more efficiently for their own business. And that's what we're about at PocketDok, and I don't even think we're going to have to wait 10 or 15 or even 5 years. I think that's on the horizon right now.
Well, that is great. It is sad that what triggered this, was an injury, but the result of it is really very impressive, and we are so glad that you shared this with us and spent a few minutes with us during one of our core webinars. So I would like to thank you, Lisa, and also our thanks to Faye for joining us today. So we're going to shift gears a tiny bit and go back to another polling question, and then we'll take some questions. Drew?
Great. Thank you, Jessica, and thank you, panel. And we'll bring us to our second and final polling question of the webinar before we jump into our Q&A portion. This question reads, which of the following was the biggest challenge to your organization's implementation of the CAQH CORE Operating Rules? And just like last time, I will open the poll, and we will pause just very briefly before our Q&A portion for everyone to respond here. So just take a quick second or two and log your response, and then I'll share the results in about 10 seconds. Take about 5 more seconds. All right, I will close the poll and share the results. So I can see here the largest percentage, 40%, saying overcoming resource constraints, and these could be time, staff, or internal expertise. 25% saying fully understanding the operating rules. Certainly there's a lot of details in them and lots to sort through. 18% said that they did not encounter any challenges or this is not applicable to them. 8% saying working with the testing and working and testing with trading partners, and then 10% saying identifying and completing necessary system updates. So very interesting to see, and just know that if you ever have any questions, we are always open and ready to help you. And check out and register for our upcoming education sessions. We're always planning new sessions in the future. And so with that, I think we'll move on to our Q&A portion. And Jessica, I'll hand it back to you.
Thanks, Drew. And I would like to remind you to please submit your questions by typing them into the questions panel of your dashboard. And in order to better answer your question, please identify the type of stakeholder you're with. So the first question is for PocketDok. So I'm not sure whether this question is for Lisa or for Faye, but the question is, how do I get access to PocketDok's products?
I'm happy to answer that for PocketDok. If you are a software developer or you are a health IT professional and you would like to get started right away writing some of your own code, you can visit our website, PokitDok.com, and you'll see a section for developers, and you can sign up for an API key right there for free. and get started and test all of our API endpoints for 30 days for free, and the X12 EDI clearinghouse transactions remain free of charge. That's if you are someone who likes to write code. If you're an enterprise professional and you would like to understand more about whether or not we have enterprise solutions pre-built for you, which we do, you can also find information on our site at PokitDok.com and contact us, and we're happy to talk to you about it.
Thank you so much. And my next question is for Bob. So Bob, the question that's come in is, are HIPAA-covered entities required to implement the CAQH core rule requirements pertaining to the use of acknowledgements to comply with the ACA?
That's a great question, Jessica. And there is a distinction when it comes to the acknowledgements. The acknowledgements were specifically excluded from the requirement of HIPAA-covered entities to implement under the federal regulations and policies. So the core requirements for voluntary core certification, like the certification that PocketDok has gone through, they have completed those requirements. They do implement those requirements for acknowledgements because they've pursued voluntary core certification. Entities for the regulatory component are not required to complete the requirements for acknowledgements for the ACA mandate. So there is a distinction specific to acknowledgements and acknowledgements only. So we are very clear with that in our FAQs and in our education materials, as well as anything that we pretty much publish when it relates to the acknowledgements. There is that distinction. So if you are planning on pursuing voluntary core certification, you want to make sure that you understand that specific requirement around acknowledgements that will pertain to voluntary core certification testing.
Thank you, Bob. The next question is from Matthew. Matthew, why is testing required for core certification?
Thank you, Jessica. This is almost like an easy question, but a hard question too, I guess. You know, part of it is that that testing is what we were talking about earlier, a third person testing, a third party that's testing, looking over your shoulder, making sure you're doing it right, and the tool to do that is certification testing. More universally, and to echo something that Lisa brought up, that we want to look to other industries to see what they're doing. And in other industries, certification testing, conformance testing is a big thing. You know, you see it with machine tools, drilling. Almost every other industry has this concept of how do I prove conformance? And many industries use the same model that CAQH CORE uses, which is, well, let's get industry together and decide what conformance means. Here we have the requirements, but let's talk about what needs to happen in order for an entity to prove that it is conformant with those requirements. And many other industries say, well, we develop a test. And so that's what we've done with certification testing. Industry has developed a test, a series of questions that have to be answered. And once those are answered, then that meets the conformance requirement that core certification has set up. So there's your core certification testing.
Thank you, Matthew. So the next question is for Bob, and it's from the state Medicaid agency. And the question is, are there plans in a future core phase to make some of the infrastructure rules, such as connectivity, uniform across all of the transactions?
That's a great question, and I would say that yes, in the future phase, we would probably, as we've done through kind of our entire life cycle of rural development, we've looked at where the industry is at doing that initial environmental scan, and we build operating rules and requirements around what is the best approach to move forward the entire industry. So remember, the rules are related to health plans and providers and software vendors and clearinghouses. So we all have to be able to take those steps together to make sure that the industry makes progress. So beginning way back in 2006 with phase 1 up to now with phase 4 being available for voluntary adoption, we've migrated to a very specific connectivity, very specific requirements for security, which is not the same place where we were back in 2006. So each phase does have that kind of unique approach when it comes to connectivity, although many of the requirements are very basically the same. Free internet, access over HTTPS, requirements for sub-WSDL, requirements for specific security for digital certificates. So many of the very basic requirements are the same. There are subtle differences around the transactions. So we can definitely see, if I could foretell the future, a future phase 5, we would be combining some of those requirements for the uniform set for the operating rules. Now, with that being said, we do have in the rules the requirements for safe harbor. And safe harbor allows you to build whatever you need to do to conduct your business with your trading partners at a minimum requirement being to support the core required connectivity and all the operating rules for conducting the transaction. So that safe harbor allows you to build upon and move beyond what the core rules require. You'll have to meet the minimum requirements, but if you want to continue FTP service for your batch transactions because you get hundreds of thousands of claims from some of your larger hospital systems or some of your larger clearinghouse trading partners, definitely can keep and maintain those types of connections. But if it is specific to certain transactions, again, meeting the minimum requirements, the floor, building upon that to meet your business needs is definitely something that you can do.
Thank you, Bob. And then I have another question here for PocketDok. And the question is, well, it's more of a comment. Someone would like to understand a little bit more about PocketDok's business model. Could you share a little bit more about that with us?
Absolutely. So most clearinghouses today, if not all, and I believe the answer is all, besides PocketDok, they charge a toll, I like to say, for moving your data and your request to and from the provider to the insurance company, which would be a little like a state or someone else putting a toll booth on a freeway to pay for the cost of building the freeway and never taking the toll booth away after the freeway has been paid for. So the way PocketDok thinks about it is, I'm not going to charge you a toll for making a request from a health provider or other to an insurance company or trading partner for information, because that's the cost of doing business. That's really in the era now of cloud-based web services, the cost of making that request and returning the answer is so low that we really shouldn't be, once the work is done to modernize those clearinghouse rails, what PocketDok has done, we shouldn't be charging you a toll for that. What we charge you for is the value we build on either end of that transaction in the form of analytics, in the form of pre-built solutions that take advantage of those transactions, such as cross-EMR scheduling, transparency solutions where patients can shop for a procedure, see its price, choose to pay for it up front if they haven't met their deductible, schedule, take that payment, and send the relevant claim for credit for that, even self-pay payment, to their insurance company. We charge for that value built on top of the transactions. We don't charge a toll for the clearinghouse transaction itself, and I don't think anyone out there really should be paying those tolls anymore.
Thank you so much. I've got another question for Matthew, and the question is, can penalties be assessed against entities that fail to comply with the mandated operating rules?
That's a good question, and it turns out that they can, and this predates the Affordable Care Act. So we still have the original HIPAA, right, late 90s, the original HIPAA enforcement framework, which is still in place today. And so today you can, anybody can submit a complaint if you think somebody is not being compliant with the operating rules or with the standards or any of the administrative simplification requirements. You can submit a complaint to CMS, Centers for Medicare and Medicaid Services, that's working on behalf of HHS, and they will follow up with that complaint. Now, that complaint process usually means sitting down with the alleged offending party and bringing that party up to compliance. But at the end of the road, CMS does have penalties that it can exercise if an entity is not compliant and refuses to comply with any of the operating rules or standards. Now, there's the Affordable Care Act has mandated a number of second layer, if you will, of enforcement framework, one of which is an audit, and we hear murmurings of that coming from CMS, but we haven't seen any formal announcements on that, and an audit program that will look out for compliance, and that will have its own penalties associated with it, as well as the certification of compliance program that was mandated by Affordable Care Act. Again, we're waiting for regulation or final regulation on those mandates. But under that mandate, it again is another framework. It's a bit more aggressive than the original HIPAA framework in that if you don't comply with whatever the regulation requirements are for that certification of compliance, the penalties are very, very steep. And I think most of us are aware of those, $1 a day for every covered life up to 20 days. So, but we haven't seen final regulation on that. So I'll get back to the original question. We haven't seen any of the steep penalties and aggressive enforcement actions put through final regulations from the Affordable Care Act, but there still does remain the original HIPAA enforcement whereby you can file complaints. And, you know, I strongly urge anyone who is dealing with a trading partner who they find is not compliant with the operating rules or with the standards to file a complaint with CMS. There may not be penalties at the end of the road, but I think you'll find that CMS will probably do everything it can to bring that entity into compliance.
Thank you, Matthew. I've got another question for Bob. And Bob, I know you touched upon this in your presentation, but would you walk us through one more time which of the HIPAA-mandated administrative healthcare transactions, which of those CORE has developed operating rules for?
Yeah, definitely. For phase 1 and 2 and 3, so those 3 different phases of CORE, we have developed operating rules that are required for implementation for the eligibility and benefit transaction, the 270-271, the claim status transaction, the 276-277, the 835, which is the claims remittance advice transaction, and the EFT transaction, so the CCD plus transaction, that is the transaction that's generally conducted between banks for the EFT payment. Those are the 4 transactions that we have operating rules that are required for implementation and support by all HIPAA-covered entities under the ACA. We've also developed the phase 4 rule sets. So for the other 4 transactions, there is a voluntary set of operating rules that, again, are free and available on our website. That includes the claim, which is all 3 versions. So the professional, institutional, and dental claim. There is a set of infrastructure operating rules for the claim, as well as the 278 transaction, so for the prior authorization, as well as the 834 and the 820 transaction, the premium payment and the benefit enrollment and disenrollment transaction. So those 4 transactions are part of our phase 4 rule set, and again, those are voluntary at this point, but they are being considered by NCVHS and HHS for formal adoption under the ACA operating rule requirements. So more to come on that, hopefully later this summer, if not sooner, if those will be required. So again, it's kind of a wait-and-see status for those, but they are available for voluntary certification, which will be launching also later this summer. So health plans are already gearing up to become voluntary CORE certified for the 837 claim and the 278 transaction, which is pretty exciting.
Thank you, Bob, and we will have future webinars on that, which we will share, the latest news. And it looks like we are about out of time for today. First, I'd like to once again thank our guest speakers for joining us, Lisa Maki and Faye Bobian. I'd also like to thank our audience for being with us here today. A recording of the session will be available on our CORE website within the next 24 hours. And we'll send you a copy of the slides and the recording at that time. Please register for our upcoming webinars by going to the CORE website. Also, this slide has some ways to connect with us, including our free resources. And thanks so much. You may now disconnect and have a great rest of your day. Bye-bye.